And we are learning more today about the federal healthcare teams that are coming to Dallas and across Texas to help hospitals treat COVID-19 patients. One of those teams, we understand, will soon be going to Parkland Hospital. Jack Fink first reported on all this yesterday. He is live in Fort Worth this evening with an update on what we know right now. Jack?
Doug, a spokesman at Parkland Hospital in Dallas says a federal healthcare team will be arriving sometime next week and will be working in a variety of roles in that health system. The chief of the Texas Division of Emergency Management told me today it's one of 7 disaster medical assistance teams heading to Texas to make sure that staffing levels at hospitals are adequate for treating patients.
They've had executive teams and assessment teams here with us all week and are working with our regional advisory councils as well as our hospital folks to make sure that we get the right level of need at the right time in the right location.
Staffing is the major concern for many hospitals across Texas, and so these disaster medical assistance teams will help gauge whether there are enough doctors and nurses to staff ICUs and other parts of the hospital. The state is working with the Department of Defense, Veterans Affairs, Health and Human Services, and FEMA. For now, Chief Kidd says the state has more than 11,000 general purpose hospital beds and nearly 1,000 ICU beds available throughout the state. In addition to the federal help, Chief Kidd says the state has brought in more than 2,300 contract doctors and nurses.
So some of them live in Texas and have worked in Texas. Some of them are from out of state, and they've been working for several days, maybe a couple of weeks even, in certain areas across the state. The point is, we'll continue to ask for more.
Now, he warns, though, there is not an endless supply of those contract doctors and nurses. Now, federal funding for the 5 community testing sites in Texas, including one here in Dallas, is set to expire next Tuesday. And Chief Kidd says that one concern they have is with this intense Texas heat, it's taking a toll and making it difficult for the nurses providing all of those tests for the long lines of people waiting in their cars. And so they are now looking at some other options available. But he said one thing is for sure, they know the demand is there and that testing capacity is not going to be abandoned. Live in Fort Worth, Jack Fink, CBS 11 News.